Hello everyone. In this video we are going to talk about inflammation. Inflammation is redness, swelling, pain or a feeling of heat in an area of the body. This is a protective reaction to injury, disease or irritation of the tissues. Sign of inflammation: redness, swelling, pain, heat, loss of function. Types of inflammation: acute and chronic. Acute is rapid, chronic is slow. The cells involved in acute inflammation are neutrophils. The cells involved in chronic inflammation are lymphocytes, monocytes or macrophages. Tissue injury in acute inflammation is mild and self-limited. Tissue injury in chronic inflammation is severe and progressive. Acute inflammation is a short-term process occurring in a response to tissue injury, usually appearing within minutes or hours. It is characterized by 5 cardiac signs: pain, redness, immobility, swelling, and heat. Causes of acute inflammation: physical agents such as radiation, electric shock, sudden change in atmospheric pressure, mechanical trauma, bacterial, viral or fungal infection, tissue necrosis, foreign bodies, chemical injury, immune reactions such as hypersensitivity reaction and autoimmune disease. Events in acute inflammation: there are 2 main events of acute inflammation are vascular event and cellular event. In vascular event, initially there is transient vasoconstriction of arterioles. After that there is persistent progressive vasodilatation. This vasodilatation elevates local hydrostatic pressure. This leads to increase in vascular permeability. As there is increase in vascular permeability, there is transudation of fluid into the extracellular space. This leads to slowing of microcirculation. After that there is leukocyte margination. Cellular event: recruitment of leukocyte, activation of leukocytes leading to the process of destruction of invaders and production of mediators by phagocytosis. Steps in leukocyte recruitment: margination, cells line up against the endothelium; rolling, close contact with and roll along the endothelium; adhesion, connecting to the endothelial wall; immigration, cells move through the vessel wall to the affected area. Morphologic patterns of acute inflammation: serous inflammation, accumulation of excessive clear watery fluid with a variable protein content, occurs in skin and in peritoneal, pleural and pericardial cavities. Fibrinous inflammation: large amounts of fibrinogen pass the vessel wall and fibrins are formed in the fluid exudate of extracellular space. Suppurative inflammation: the formation of pus. Pus is made up of neutrophils, necrotic cells and edema fluid. Ulcerative inflammation: chronic inflammation is also referred to as slow, long-term inflammation lasting for prolonged periods of several months to years. It may or may not be followed by acute inflammation. Causes of chronic inflammation: autoimmune disease, allergic reaction, immune response, prolonged exposure to toxic injurious agents, persistent infections. Morphological features of chronic inflammation: in chronic inflammation, there is inflammation, tissue injury, and attempts at repair. Inflammation is due to infiltration with mononuclear cells. Tissue injury is due to persistent offending agent or inflammation. Damaged tissue is replaced by connective tissue. Role of lymphocytes in chronic inflammation: microbes and other environmental agents activate T and B lymphocytes. This lymphocyte amplify and propagate inflammation.